Good morning, everybody, future PA colleagues. My name is Lisa Walker, and I have been a PA since 1994, yes, 30 years now, and a PA educator since 1997, so long time. It's great to be with you this morning. Thank you for joining us and for your time and attention. I have reviewed thousands of applications in my career, so I'm going to be talking to you this morning about writing a memorable personal statement. So let's get started. So just a few key points before we get into the details. This is why I called it Getting to Know You. This is your opportunity to help the reader get to know who you are beyond just the facts in your application, and also to provide context for those details in your application. So we'll talk about some of the context that might be necessary depending on your background and things. It's an opportunity for you to show how you are uniquely suited to become a PA. It's your chance to tell people your why. Really, why do you want to be a PA? And we'll talk about answering that question too. So because of this, I really want to encourage you to use this space wisely. Here's your first don't in writing your personal statement in the CASPA application. Do not regurgitate the information on your resume or in your application. Don't talk just say, I was a medical assistant for 5 years at a community health center. I volunteered here. I taught this. Don't say those things. Make sure that you use this space as a place to help the person who's reviewing your application to get to know who you are better. So you need to first make sure that in your personal statement, you answer the prompt. And the prompt is, please explain why you're interested in being a physician assistant. So what do you need to talk about in your essay? You need to talk about what attracted you to the PA role, and be specific here. Why PA? Why not nurse? Why not medical school? What is it about the PA role specifically that has attracted you to wanting to join the ranks of other PAs working in healthcare? In talking specifically about the PA role, here's the trick. Don't speak negatively about other healthcare roles. Don't say like doctors don't spend time with their patients, but PAs do. Don't say that nurses, the role of the nurse is not important enough, and I want to have more engagement with the patient. So you really need to understand the role of the PA in order to talk about this. And if you need some resources to understand both the history and the role of the PA better, if that's something that you're not completely clear on yet, I really want to refer you to both the AAPA, the American Academy of Physician Assistants, has great stuff on their website for pre-PAs. The PAEA, who's sponsoring this, has some wonderful pre-PA information there. And also the NCCPA, which is our national certification organization, has a PA history website. So I encourage you to take a look at those references in order to be able to really talk about the PA role and what it is that attracted you to it. So you also want to talk about your fit for the profession, not just what you love about PAs, but what's going to make you an amazing PA. What are your qualities, characteristics, experience, skills that are all going to culminate to make you this fantastic PA that the programs you're applying to, they really want to have you in their cohort, because once you get out there, you're going to do incredible things as a PA. And don't just say phrases like, I'm a team player. Give at least one example of how you demonstrated a quality or a characteristic. Just stating that you are something or you do something a certain way is less impactful than telling a story about how you demonstrated that skill, that ability, that quality. So make sure not to try and stay away from just blanket statements. rather than really talking about how you demonstrated that that quality and characteristic. Another thing that I want you to do is to think about using stories and helping the reader to connect to who you are through those stories. We connect to other people through stories, not statements, right? You know, statistics are useless in helping us understand something. But when we read a story, it really, you know, if we think about like the maternal morbidity and mortality, right? All those statistics about women of color experiencing a greater proportion of more maternal morbidity and mortality. That's a statistic, but we hear a story about someone, it's much more impactful. So tell your story. I do want to caution you, there are some themes and stories that are a little bit overdone. And after having read thousands of applications, I'll be honest with you, when I see these stories, I kind of roll my eyes a little bit and say, uh-oh, here's another one. And they are, first of all, there's the hand-holding theme, which is stories about how you had an impact on a patient that you engaged with. That's a great story. Try to find a little different angle outside of the, you know, I sat at their bedside and held their hand, right? You know, having an impact on your patients in whatever role you're in right now, or whatever role you're planning to go into before embarking on your PA career. You know, those are really good stories, but try to find a little bit of a different angle. The other overused story is the medical mission. So if you had an opportunity to participate in going to another country and providing some form of support or care, that's great. Again, sort of look for an angle, and I'll talk a little bit about angles in a little bit. And lastly, you know, a PA saved me or my family member. It's a good story. It doesn't really give me enough information about what it is you love about the PA profession. So I understand that you loved that PA and that person introduced you to the profession. That's okay. You know, that can take up maybe a sentence or two in your essay. But then we really want to hear what it is about the whole role of the PA, not just this one person who had obviously a very important impact on you through their care. But expand on that and talk about what else you've learned about the PA profession and the role of the PA if you're going to tell some stories. So just a couple of overused themes that we see in our application essays. So more about the what that you can talk about in your essay to have a greater impact. Think a little more about the role of the PA outside of their role as a clinician. If you can do it with knowledge and sincerity, don't fake it. You need to understand what are some of these other roles that PAs serve in. It can be really impressive and impactful to an application reviewer to talk about how you'll serve in how you would be interested in serving in a leadership role. You want to be active in the PA professional organizations. You want to volunteer as a PA. There's lots of things you can talk about in addition to the clinical function of the PA that interests you. And that makes us excited about you as a candidate because our graduates are important to us. Our alumni really reflect back on the program. And if we have alumni who become leaders in the profession, leaders in hospital systems, leaders in educational setting, that really reflects well on our program. And so if you express an interest in potentially teaching one day or having a higher level administrative role in healthcare, that can help to kind of encourage us a little bit to take a deeper look at you. So, you know, you might also talk about how you envision yourself contributing it to the classroom or the program as a student. You know, if you have ideas about wanting to volunteer as a PA student, if you think you might have interest in being a class leader, or you had you have tutoring experience in your undergrad years and you would like to create a tutoring group with your classmates. That also helps us see you in the classroom, right? It helps us envision you as a student in our program and think about you beyond just somebody who's going to sit in the seat and soak up all the knowledge we're going to send your way. So if you have ideas about that, it can really make your essay stand out. And this, please, please, please take this to heart. If you had academic challenges during undergrad, address them directly in your personal statement. Admit what went wrong and describe how you have overcome those challenges or how you will in PA school. Because if you just ignore it, we're going to see it. We're going to notice the C's in your microbiology and your biochem. We're going to notice that you had a real dip in your grades in the spring of your freshman year. We're going to notice those things. So please, please make sure you address them. This is when I'm talking about giving context to all the details in your application. That's what I'm talking about. Another thing you should address directly in terms of providing context is if you have gaps in your employment, or if you were jumping around a lot. You only spent 2 months here, then 3 months there, then 6 months in another place. Talk about those things. What happened? What have you learned from those experiences? So I want to make sure that you provide that context so that we're not left trying to fill in those gaps ourselves as the reader. Because if it looks to us like a red flag, that's not going to be helpful in terms of your having an opportunity to be invited for an interview. So make sure you address these things head on. And the important thing in addressing them is, again, talk about what happened, talk about it honestly and openly, and then describe how you have made changes, how you've overcome those challenges. So in putting your essay or your personal statement together, I really want to encourage you to start with an outline. An outline helps us write. It helps us get a sense of the flow of what we want to write about. As much as possible, try to use a chronological approach that tells your journey to the PA profession, right? How did you get here? How did you get to this place where you want to apply to PA school? So try to use a chronological approach because it helps the reader follow the story and tell us your journey. It can be impactful to start with a story. I'm going to give you an example of that in a minute. And I encourage you not to start with a quote. A lot of people start their personal statement with a quote. If you want to embed it somewhere, put it towards the end of the personal statement. That's okay, but it really is wasted space as far as I'm concerned. It may tell me a little bit about your values, who you admire, but there's no context to it. So I would encourage you, definitely don't start with a quote and don't waste a lot of space or time on it. Starting with a theme, an analogy, or a story, and then referring to it at the end of your essay, kind of bringing it back around to what you talked about in the beginning, is a really nice writing technique, and it gives the reader kind of that, you come back full circle. And I'm going to give you an example of that. And also, you want to make sure that you'll talk about, and I mentioned this in the previous slide, why you'll be a great PA in the clinical setting. Then next, how you might contribute to the classroom or the profession. So start out with the clinical you as a PA, and then try to incorporate a little bit about the contributions you might make as a PA student or contributions you might make to the profession as a PA. Okay, it's great to be creative. But within reason, right? And you want to be creative, but not cute. Cute just kind of falls flat, and I don't know. That's probably a personal bias of mine. Don't be so creative that the reader is rolling their eyes and going, "Oh boy, this person went crazy trying to write a creative story." One of the best essays I've ever read, I call it a fish story because that's what it was titled. It was an applicant who had worked on a commercial fishing vessel and started their essay, their personal statement, with a story about the vessel they were working on being in a competition to catch the biggest fish. And it was written in a way that, I mean, I was immediately hooked, pardon the pun. It was exciting, it was exhilarating. You could almost feel the excitement of the moment, being on the boat and catching this big fish and hoping it was big enough to win the tournament. So that was the beginning of the story, and it was about a paragraph long. Why did they take up so much time at the beginning of their personal statement, talking about something completely unrelated to PA, to why they'd be a great PA? She brought it around beautifully to several things. One was her journey of trying to get into PA school, which had been a long and complicated one. And how, while it was exhilarating, it was also frustrating. And you know, she talked in the story about being on the boat. It's cold and it's raining and they're tired, you know. So she related the story back to her journey, and she also related her story to her qualities of teamwork, persistence, effort, and the whole. And then she brought it back around at the very end, you know. So she started with the fish story, then she talked about you know, her journey of trying to get into PA school. Then she talked about her persistence, her teamwork, and then she brought it back around and said that, you know, she hopes that this time she'll catch the big one, right? The big fish, meaning that her application would be successful. So that's just an example of a really creative way of framing your personal statement. Now, I don't want you to feel pressured to do this, you know, and if you do it, you want to make sure you have people take a look at it and give you some feedback. But I will tell you, boy, it makes an essay stand out. This is somebody who we're not going to forget. In your essay, be positive and upbeat. Express your passion for medicine, for the PA profession. Express your excitement about the future. It's okay to talk about something that went wrong. You know, like I said, you need to give context, as long as it illustrates an important point or gives context to the details in your application. If you do talk about a negative situation, something that happened at work or something that went wrong with a patient, make sure that you take personal responsibility and show what you've learned or how you've changed in telling that story. Whatever you do, don't blame others for anything. Don't make other people look bad in your essay, because that's just a red flag. You want to really talk about you, and you should talk about you in a positive and upbeat way. Talk about the PA profession and medicine in a positive and upbeat way. And if you do want to tell a story that perhaps, you know, was something that went wrong, that's perfectly okay. Make sure that it illustrates an important point, and that if you had a part in that, you take personal responsibility for it and show what you've learned. All right, you've written your essay. Yay, good job. Once it's written, proofread, spell and grammar check it several times, and then pick a few trusted folks to read it and give you feedback. Take that feedback to heart and incorporate what you feel will strengthen your essay. That's really important. Don't just write this thing and submit it. Make sure you have folks look at it and give you some feedback. And definitely proofread. Nothing will kill the joy of a well-written essay faster than typos or grammar errors. So make sure that what you submit is pristine. And really, that's all I have. I think we ended right on time. It was supposed to be about 20 minutes. I hope this is helpful, and I'm certainly happy to answer any questions that you might have about writing your personal statement in your CASPA application.